in this class may not. Now, Miss Moore focuses on some numbers on the test, okay? But in clinical, we'll talk about the numbers so you'll understand those concepts to extrapolate to the test. But the big key is, how am I setting up the patient? She's going to talk about plebistatic axis. And now you're saying, oh my God, she's talking about multisyllable words again. But you need to know that. That's a test question. There'll be something about plebistatic axis, and that's where I have to line up to get my hemodynamic pressures. So those are things that we will work on in clinical, because it's easier when I have a patient. I can say, okay, let's determine where the plebistatic axis is. Head of bed elevation can't be over 45-degree angle. So if you're taking measurements in a patient with a head of bed elevated greater than 45, inaccurate. So that's real important stuff. So accuracy is more our focus on making sure what we get to interpret is appropriate. And you're going to hear that all along the way. And then basic EKG. You're going to have to know what that PQRST is. You're going to have to know your numbers. And we'll start running some strips now, because you're going to be tested on it a couple times. There's also advanced dysrhythmias later in the semester. So the issue is, you have to know those numbers. It's going to be on test questions, I guarantee you. Yes, Will?
Is there a clinical focus sheet for that February 2nd?
February
focus sheet?
clinical focus sheet for
Yeah, I don't seem to see one in the
For the cardiac assessments.
cardiac assessment.
There's one.
There should be. I know, but he's asking about on this. You're asking the handbook, aren't you?
Right.
There anything that says clinical assessment?
I'm missing right past that one.
Okay, I'll go back and look.
I'll run and look.
I'll check it.
Get it.
She's going to check it at the break. She's taping this for the Monday group that didn't get an opportunity, so now they have to listen to this mess on the like integrity experience. But you get the life experience. Isn't that more exciting?
One thing that I'll throw in, like all this stuff that she's talking about. Remember how I said we're not going to reteach first semester, second semester? This more than any time you've been in prereqs or have been in class, you have to get your content from that first lecture and get a hold of it and have a good grasp of it. You know, go see your instructors if you don't have a good grasp of it, because everything builds. Drugs that I cover in hypertension, guess what? They're going to come up in the heart failure lecture.
failure.
They're going to come up in, dysrhythmias. They're going to come up in shock again. So you've got to basically stay ahead this semester. If you drop behind this semester, it is close to impossible to catch up. It's just the way it is. And that's what we see. And it's like, well, I can make it up on the other one. No, not enough points. And the content keeps coming over and over and over again at you.
And the first two tests tend to be the hardest ones, and I don't know if it's because it's just different. I just try to warn people that that's usually where they have more troubles, the first two exams.
A lot of content.
There is always, unfortunately, the whole course is
Yeah,
full
the
of
whole
content.
course is full of content.
You know, you have the whole oncology concepts, you have the whole hematology concepts, and you have shock.
Metabolic.
To me is a breeze, but metabolic, and then the rest is all cardiovascular.
When
the
I
whole
do
system.
shock at the end of the
It's
semester, y'all are like, that, I know that. Because it is a building
Yeah.
semester, so much so that it's like, that makes sense, that makes sense, that makes sense. So don't get behind, cannot stress that enough.
Get all those, what's those things called?
Those things.
Yes, please, get those
Get them done.
Just get them, hopefully you're almost gone done. Just blow it over. Because don't have all this sundry other crap to work on.
And don't wait until the last minute on your interview.
Was that last semester that the person
He
left or
left
got
and they
sick
did-
or
yeah,
something,
he left.
and it was like, it's like, we can't get our interviews in, so get it done.
Okay, February 9th, and again, I'm not reading this to you, but big respiratory failure day. Now, some of you will be in ICUs, and so you'll have a chance to give ventilator patients. That's great. Correlates exactly what's going on, but not all of you. cause we cannot put all 10, we can't put 20 people on Tuesday at the medical center in ICU. There's not 20 patients, okay? So